Ask you to stand for the Pledge of Allegiance. Good morning. Welcome to the October 30th, 2018 County Commission meeting. I'd remind you to silence your cell phones. The meeting documents are on the end of the counter in the white folder. And if you needed a listening device, Carol in the front can help you. Commissioner Barth?
Thank you, Madam Chair. I just want to say a few words about one of our predecessors whose funeral is today. Mike O'Connor was on this commission. In fact, he was the last Democrat to serve here before me. And after he retired, there were 4 years with no Democrats. But I remember a couple things I want to say. One of his sayings, which I should listen to more often, was, I've already told you more than what I know. And I tend to spout a lot of stuff, and he actually was kind of a mentor and a guide to me, and he often said, don't be against stuff, be for stuff. And I guess we just said the Pledge of Allegiance, and we say the Pledge of Allegiance these days because of him. 12 years ago, or 16 years ago, we were coming up on the anniversary of 9/11, and he was the vice chair of the county commission. And the chair was gone, and he began the meeting with, please rise for the Pledge of Allegiance. And we've said it ever since. And he took that moment in hand as the vice chair and made it happen. And I think we all have to appreciate his efforts. You know, all of us owe a lot to our predecessors. And sitting there watching him sit up here and watching Jim Zweep and Carol Tweet and all the others, there's a lot to be learned. I have to commend those who seek this position, that attend these meetings and learn. I learned a lot from Mike, and I know Gerald just commented that Mike hired him originally. Was it mowing the lawn or what?
No.
Anyway, thank you very much, Madam Chair, and I return the floor.
Is there anyone else that has comments?
Well, I would follow up with what Jeff said. He was a class act. When I applied for the job at Active Generations, he was chairperson of that board and was on the executive committee and actually hired me. So for 30 years, he would come in and check on me on a regular basis to make sure that I was doing the right thing. And I grew to admire him. As Jeff said, he was an extremely positive thinker. And the thing that I would always remember is his comments as he would leave, because they were always encouraging to move ahead and do something. So as Jeff said, we've missed a huge public servant for a long time.
Thank you, Commissioner Barth. With that, we'll move on to routine business. Item number 1 is consider a motion to approve the agenda.
So move.
Second.
A motion and a second. All those in favor say aye.
Aye.
Those opposed, same sign. Motion passes unanimously. Item number 2 is approve the meeting minutes from October 23rd, 2018. Item A is the commission meeting minutes. Is there a motion?
Motion to approve?
Second.
I have a motion and a second. All those in favor say aye.
Aye.
Those opposed, same sign. Motion passes unanimously. Item B is the joint Minnehaha County and the City of Sioux Falls meeting minutes.
Move for approval.
Second.
A motion and a second. All those in favor say aye.
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 Those opposed, same sign. Motion passes unanimously. Item number 3 is bills to be paid in the amount of $2,178,743.30. Is there a motion?
Pay the bills.
And a second from
A
Commissioner.
second and a comment?
And comment from Commissioner Bender.
Just a couple of things that are new in this series of bills. We have our first bills for county inmates that are being housed out of county, and this will be ongoing until we either get the new jail completed or we make a decision about what we're going to do with the CCC. I would really like to commend the warden. However, he's really worked at managing that population and arranging it so he's maximizing the amount of beds that we have available. And I noticed I get a printout every week of where we are and where our inmates are, and he's been able to reduce the amount of inmates that we have out of county right now. So I really appreciate the efforts that he and his staff are doing in that area. The other item is related. We have our first drawdown payment for the construction of the jail, and I'd actually like to invite Karen Muller-Fuller forward, and she's going to explain kind of the process that we go through to vet out those drawdown payments.
Good morning, Commissioners. Carol Muller, Commission Office. Yes, before you is the very first pay app or drawdown for the construction of the jail. You've been seeing the bills all along for some soft costs, including the architects, but this is the first one that you've actually received for construction, which is for $1.16 million. And you'll be seeing them on a regular basis every month, towards the end of the month when you'll be doing that. Just a couple comments that I would put in there. The largest amount is $588,758, which is for the precast concrete, and we actually can visibly see all that being worked on. There's a lot of very visual work that the guys have been doing out there, and so you can actually see a great progress being made on things. There was $129,000 for site construction, including demo, earthwork, and utilities. There are also a couple things that are one-time payments included in that, including the builder's risk insurance, which was 0.7, less than 1% of the contract, which added up to $305,000, and also the pre-construction fee, which per contract was $50,000. So you've got a couple one-time bills that are in there, and then we're starting to see some other things move through, and we'll continue to see that happen over time.
Thank you, Carol. Additional comments?
If you could just explain a little bit about the process, who looks at these bills
Absolutely.
and how we are processing it through
Sure.
the county.
Sure, I can, Commissioner Bender. Yes, J.E. Dunn, Henry Carlson work together to put that together. They submit that to Tegra, who serves as our owner's rep, who go through it with a fine-tooth comb for us. We appreciate the work that they do with us. They stay in touch with us during that particular process on that, and then we do not approve anything until we've got the stamp on there from Tegra with their approval. We also then continue to go through the bills and look at them. I went through them all twice yesterday. Since I was gone last week, I actually took 2 times through them yesterday, and we'll be meeting this afternoon just to continue to work on the process and help us understand what all the bills mean and everything. So they're gone over many times.
And I appreciate that. I appreciate the work that Tegra has done for us. I think everybody on the committee feels like they have certainly earned their fee in the work that they did to put our team together in the first place, and the work that they are doing ongoing and helping us monitor these bills and make sure that every penny is accounted for. I appreciate Carol's work and the work of the auditor's office, and there'll be a lot of money coming through now, and so I just wanted to make sure that the commissioners and the public understood that we are really carefully vetting those bills before they're brought forward for approval.
And maybe just to put it in perspective, the total amount of the construction contract was $40,683,835. So that's where the $1.16 million comes out of that.
Additional questions for Carol? I have a motion, a second on the bills. All those in favor say aye.
Aye.
Aye. Those opposed, same sign. Motion passes unanimously. Item number 4 is reports. Item A is the Minnehaha County Juvenile Detention Center report for September 2018, and that's on file in the auditor's office. Item number 5 is personnel action. Item A is consider a motion to approve the routine personnel action.
So moved.
Second.
Motion and a second. All those in favor say aye.
Aye.
Aye. Those opposed, same sign. Motion passes unanimously. Item number 6 is abatements recommended for approval. There are none. Item number 7 is notices and requests. Item A is authorize auditor to publish notice of the sale of public auction on November 29th, 2018 of a surplus of 2005 Sterling snowplow truck. DJ, do you have anything to say on that? Is there any questions for DJ on that notice?
Move approval.
Second.
Motion and a second. Any other comments? All those in favor say aye.
Aye.
Those opposed, same sign. Motion passes unanimously. Item number 8 is planning and zoning notices. There are none. Item number 9 is petition for compromise of lien. There are none. And next, we have opportunity for public comment. Is there's anyone who would like to speak on something that is not on today's agenda? Good morning, Nikki.
Good morning, Commissioners. Nikki Gronley, 24620 479th Avenue, Del Rapids. We are 1 week out from the election, and we all know what sacrifice everybody makes when they're running for office. So this morning, I just want to encourage everybody in this room and those listening to get out and vote. Voting is a right that people have fought and died for. And I'm hoping people will call friends, make sure they're voting, help people get to the polls, and I just want people to get out and vote. Use the right you've been given. Thank you.
Thank you, Nikki. Is there anyone else that would like to speak at public comment?
Yes. I'm John Cunningham, 4904 South Oxbow in Sioux Falls. I'm also a candidate for County Commission, as you know. And I just wanted to say that I believe that I have some particular skills and knowledge and experience that'd be useful. But I also know that I've been attending these meetings for months now, and I've been impressed with your dedication and your total dedication to the job. And if elected, I'd be honored to serve with you.
Thanks, John. Anyone else who'd like to speak under public comment?
Hi, I'm Rose Grant, CPA, running for County Auditor. And to kind of co-opt also what John said, very impressed with the amount of things that you guys have had to cover over the last several months, and thank you for your service.
Can you give us your address for the record, please? Apologize.
210 West 24th Street.
Thank you. Anyone else for public comment? All right, with that, we'll go on to regular business. Item number 10 is consider a motion to allocate 100% of the 2018 county surplus property auction proceeds of $33,893.44 to the general fund, or to allocate $6,753.28 to the highway fund, with a balance of $27,140.16 to the general fund. Mr. Litz, I think I read most of your memo.
Good morning, Commission. Bob Litz. I guess my job is done. The only thing that we're looking for here is action needed, so it depends on how you folks want to cut up the money.
I would make a motion to approve the $6,753.28 to the highway fund and the $27,140.16 to the general fund, totaling $33,893.44.
Is there, okay, and I need a roll call vote.
Bender,
Yes.
Benega,
Yes.
Karski,
Yes.
Barth,
No.
Hiberger.
Yes, motion passes 4-1.
Thank you, Commissioner.
Thank you. Item number 11 is a briefing of the ambulance quality assurance director on the county ambulance oversight report for July 2018 through September 2018. Mr. Luther.
Jeff Luther, I'm the Quality Assurance Director for the Minnehaha County Ambulance Associations, or at least their primary service areas with respect to ground services. This is the first time report that I've done since we've changed the ordinance, where now we do quality assurance for BLS as well as ALS. I'm pretty excited. I think that with this report, what I was able to do was to pull what I think are the essentials and kind of broke it up into three pieces. One is some of the demographics aspects of the report, the quality assurance, and then some commentary on the end of the report that I could share with you. This was a 74-day reporting period. There were 344 calls in the system. This report that I've submitted to you is information I pulled from the Image Trend, which is South Dakota's EMS reporting software. We had a learning curve that I went through trying to pull the most useful information as it relates to not only ordinance, but for quality assurance purposes. This is an opportunity to pull a myriad of information, absolutely a plethora of different things that we can filter through that can be done either ad hoc, or if there's a particular interest in an area that the commission may be interested in. But I think as important, if not more important, is that I can take this information back to the primary service areas once we convene one is a medical advisory panel or board, and we can meet regularly to review more of the quality assurance trends, that if we identify a trend or an issue, that we'll be able to review those under the quality assurance parameters. So having said all of that, I started first with just a caveat that some of the calls that I pulled could be calls that are mutual aid calls, whereby one call is dispatched or a service is dispatched and another ambulance that might be ALS could intercept. Those are buried in there, and I'm able to filter those out. But for purposes of this report, I just listed what I pulled out, and you can see, first of all, the ambulance service name, and you can see the number of calls in that period that they responded to. And in this reporting period, which is not uncommon, Jasper didn't have any calls, so they're fairly low volume, and I've reported before where they have not responded, and that's just the nature of that little area that they have. So there's a percentage breakdown of the total calls. If we talk about the quality assurance, what we looked at, as you recall, in our ambulance ordinance, the types of calls that are mandatorily required, if you will, to be reported. And those include our trauma, our pediatric arrest calls, and cardiac arrest calls. And there's a 25% selection of randomly reviewed calls, and those could be anything. Try and filter out best I can those that are transport, but that's the way it is when they fill out the electronic patient care record. So of those calls, you can see that there were 11 cardiac arrest calls in that reporting period, 6 major trauma, 28 pediatric calls, which could include anything from bumps, bruises, falls to asthma, and random review of 45 charts. In what I've set for ALS parameters, which are relatively standard parameters, I found no outliers or any concerns that needed follow-up or more intense review with the individual services or provider or their respective medical directors. I did not do this reporting period contact the destination manager, the emergency department manager. I would historically do that to see if there was any reported problems with any of the service areas. I didn't do that, but we have met regularly I do meet regularly with those representatives in the city, and off record or curbside, I will ask if there have been any concerns, of which there has not been. So that's all good news. If we look at, and I got some help on this report, and I want to thank Justin Faber. I don't know if Justin's here or not.
He's over your other shoulder.
Okay, he's behind the post. He helped me put together. This is a graphic representation of some of the calls that relate to response times, call types, and it's a good visual. This can be enhanced, but I really have to thank Justin for helping me put this together. And again, it gives us a good visual representation. First slide just shows the number of EMS responses from that reporting period, July 1 to September 30th, as well as, if we look at the next slide, these are the most common responses with respect to call type. What's out there? Medical, trauma, or those sorts of things. And what we can see is that transfer makes up the bulk of what we see in terms of the services responses. But breathing problems, unconsciousness, injury accidents, falls make up a good portion of those that we can see. If there's no questions, we'll move on to this next slide, which does.
Madam Chair. Doctor, going back to the first graph there, that shows P plus with 63 calls. That's because that's only the calls in the county, not the city, right?
That's correct. That's in
And
that
so I
primary
just
service
don't
area
want
that
people
they
to
have.
have the impression that P plus is playing cards well.
Yeah, exactly. This is with respect to each primary service area boundary that they respond to. They do respond to mutual aid calls as well into other areas.
And along with that, are transfers considered emergency medical?
No, but they are, there are calls that are dispatched through the 911 center for transport. And so those are listed. And as I filtered through these call types, the numbers that I pulled, that's how many that we had were transfers.
Interesting, okay.
They can call 7-digit numbers for transfer, but in the rural community, we want to make sure that 911 or Metro Dispatch knows where these vehicles are. They only have one rig.
Okay.
So in response to, is it an emergency, the interfacility transports are routine, but we still, and I don't report on those. There's nothing really to look at in terms of quality parameters. It is what it is. They're going from one facility to a nursing home or et cetera. The next, we have an interesting, this is dispatch time to en route. And if we look at each of the services, if we can get a little bit further down on that slide there. Okay, what we see is this is the time that they acknowledge that they received the call, and this is the process from once they get the call taker takes the call and dispatches that service, that is the time that it takes. So as opposed or in conjunction with the next slide, which is en route to on scene, this is how long that it takes them to respond to an on-scene call. And we see the averages out for each one. And as per the ordinance, Minnehaha County ordinance, dispatch to en route needs to be within 15 minutes, 90% of the time, and 100% of the time within 20 minutes. And all of these requirements were met with each individual service.
May I ask a question on this? I would have assumed that the 90th percentile would be the same across the board. Why does it vary from one to the other?
As far as en route, or
On either one, the dispatch time or the en route to on scene. Why
Well-
is the 90th percentile vary depending?
That's a very good question. There are variables involved in the dispatching, meaning some of these times they're volunteers, and it takes them amount of time to get to the ambulance itself and then respond from there. There's geographic areas, and I would ask Justin, is that kind of a good explanation for that?
I guess, yeah, and maybe you're answering why it takes them longer, but I'm wondering why the standard varies from one to the other.
Yeah, Justin Faber, Metro Communications. As we look at the different services for the dispatch time to en route, is that the one? So if you scroll up one more so I can look at it on the big screen as well. So when we're looking at this, the three in the middle are our volunteer services. So I would expect those three to be very close to each other, and they are relatively close. Garrison is a little higher than the other services. The reason that MedStar is significantly lower than the rest of them is because they're staffed 24/7. So there's not a from the house to the ambulance bay to get rolling because they're not a volunteer service. The reason that Paramedics Plus is so much lower than everybody else, they have MDCs in their vehicles. So when they're dispatched to a call, they mark themselves en route. And so a lot of times they'll mark themselves en route while the dispatcher is still verbalizing the call.
But my question is, why is Paramedics Plus percentile, 90th percentile, set at 1 minute and 19 seconds versus Garrettson set at 11 minutes and 21 seconds? Why is what they have to do set so differently from each other?
Yeah, so this is not dispatch time to acknowledgement of the call. This is dispatch time to the ambulance actually physically driving to the scene. So built into the volunteer services in this time is the volunteers driving to the station.
Maybe you can just explain what that 90th percentile, how do you calculate the 90th percentile? Is that based on each individual provider's actual
Yep,
times?
correct.
So
This
it's not
is-
a national standard or
Correct, no, this
anything
is
like that?
just July to September for each of those agencies at the 90th percentile. So if you look at 90% of their calls, what's the highest number in
Okay,
that 90%?
so it's not a standard that they have to meet, it's, okay.
Yeah,
okay.
there is a standard that we do have to meet here in county ordinance, and it's 90% of the time in 1459 or less, 100% of the time at 20 minutes or less. And all of the agencies meet it. Okay.
Any questions?
Thank you, Justin.
We can try and clarify that a little bit next going around. We did have some changes with respect to the times. This ordinance, that's more consistent with what the state requires than what we had previously. Before, we had 60 seconds to acknowledge that they needed to be, or they received the call, and then 10 minutes en route. Let's see, the next slide then we have is, this is a dispatch to, this is, there's total response times to dispatch to on scene for the various services. And you can see that with the averages is what I pay most attention to. If we look at arriving to on scene is very important. We talk about that. But on certain call types, what's more important is scene time itself, especially traumas and those sorts of things that need to be transported urgently. So this here again, you know, we've I think these are, given the fact that geographic areas, this is, I think, good that we see it like it is. You know, we have in conjunction with this EMT basics that are road deputies that are able to most often respond quicker when they're available, so they're able to render care. So we do have some hands-on, eyes-on, much quicker than this if the EMT basic deputy is on shift. Not all the time, but we'll go through that as well. Is there any questions on this?
Commissioner Bender?
So Dr. Luther, if I'm a user of services,
Mm-hmm.
is this the slide that most clearly tells me, or is closest to, how long am I sitting there waiting for the ambulance to come to my house after I make the call?
This would give you an average of that, yes.
Okay. So from a
If you're
user
living in-
standpoint, this is the most important number, because that's what I care about, is how long I'm,
Times and how long you have to wait.
okay.
Considering the geographic area and the ground that needs to be covered, it's, and I'll talk a little bit about what's going on with the rest of the state to kind of put things into perspective. But these times are, in my opinion, pretty good.
Dr. Luther, we're not always just waiting for the ambulance either. I mean, we're waiting for the ambulance, but a lot of times the sheriff's office is there, or there's a Sioux Falls PD there, or there's a fire department there, and the ambulance has been called. So it's not like someone's been in an accident and no one's showed up at the scene.
That's a very good point, because the rural fire services do respond to EMS calls. So there are times I don't have, but they're invariably on scene first.
Madam Chair,
Commissioner
you
Brown?
know, Commissioner Bender asked a great question there, and Doctor, you may not know, but how long between when, you know, you make the 911 call to when someone is on scene? Do we have that kind of a number? And I don't imagine that they lollygag around at Metro Communications. They dispatch it out quickly, but there's some period of time where you have to sort of make a
Yeah.
audio assessment. Is this really an emergency? 'Cause I'm
Exactly. And I'll
late for-
let Justin explain some of those variables from the call taker time till they dispatch. It's concomitant. I mean, it occurs together, but they have to get their information to see who they want to send and at what priority level.
Yeah, Justin Faber again, Metro Communications. In terms of EMS calls for Metro Communications, we kind of triage them based on how severe they are. So the highest severity call that we have is what's called a priority 1, so it's a life-threatening event. Our goal from the time we answer the call to the dispatch of services is 90 seconds or less, and we do meet that goal. For anything below that, so priority 2, I'd say our average is right around 2 minutes. Then priority 3, which is a non-emergency call, is somewhere in the neighborhood of 2 minutes and 30 seconds. So from 911 call to on scene, you just add those numbers to these.
So Justin, let's say looking at this chart with MedStar at 17 minutes, 18 seconds to on-site, would that make it be like 19 minutes flat then?
At the 90th, yep, that'd be correct. Yep.
Okay.
Okay, thank you.
Okay, good questions. It helps me, you know, smooth out or add to or make a little bit more clear, I guess, going forward in these reports. Again, if we look at the filters that are in the, at least in the image trend data that I get with respect to not only patient information and care given, but there's a lot of other information that we can extract out of that or filter through. That would make the reporting, this, I need to comment that this is miles ahead of what I used to have to do. And even though it's still, there is a bit of a learning curve, this is much more sophisticated. And I think going forward, the information that you get, that I will give to you, is consistent and reliable. And again, it's still pulled and weighted upon once that electronic patient care record is completed. But with Justin helping me pull some of these reports from CAD based on the response times that we've all have talked about, you know, one of the recommendations from the Fitch study was fractile times, which when we look at the rural community, to me is always a bit of a struggle because of still we have parameters and variables and volunteers and those sorts of things. So it's not as clear cut as saying, well, in a contractual paid service where we can demand those via contract. But if at the commission's whim, if they have anything that they would like to see in terms of this report, I think that we can accommodate very easily. I do have some data about the call types, and if we look at those, well, let's first stop here with this. This again is a percentage of the call types for the individual services. Again, I think it's relatively explanatory there in terms of what types of calls are dispatched. If we look at the emergent, those are immediate response. Those can be P1, P2 calls, as we're referred to them as, of that percentage of calls that we reviewed, that totaled 72%. Non-emergent is 84%. That could include any kind of call that does not fit the priority layer to dispatch urgently. We have in the system the ability to downgrade from emergent to non-emergent. We can see that occurs about 1.7%, 75% of the time. And then there are non-emergents that are always upgraded to emergent, and that's about 1.17%. And then those that are already on scene. If we look at the call types, this kind of gives an idea of what we're seeing out there in terms of the medical complaints that the call taker receives. And I know there was some interest, and if we scroll down, we can see, I know that one of the commissioners had an interest in what do we do or how much do we use Narcan and overdoses. There were about 2% of all of those calls were some sort of an overdose, intentional or unintentional, that was some manner of poisoning or ingestion. Whether they're opioids or Narcan, I don't have that in this report, but I can mine that out for us. I know that sheriff's deputy, well, everybody uses Narcan now because it's becoming more and more of an issue out there. And I know that there's some interest in how much mental health issues we have out there. There is a percentage that's 1.75% of all calls that involves some sort of a mental health call, whether that's a behavioral problem, a suicide attempt, those sorts of things. And those calls are handled a little differently because we wait for clearance from PD or law enforcement before our EMS people are allowed in to render care. So it's kind of a compendium there of the various call types that we see. And if we scroll down a little bit, I think at the last part there that, are there any questions on that? And this is a disposition. This is what we're doing with the patient after we get there. You can see that we treat and transport about 64% of the time, which I think is pretty consistent. Mike, Jay, is that kind of consistent in the professional world? It's, you know, you call an ambulance for a reason, but they don't always transport. And sometimes they get there, they can render care sufficient enough where the patient does want to go or a family member will take them. And there is still a percentage of patients that call, or someone calls the ambulance, and the unit arrives and the patient refuses care or transport. And that can be from any reason, whether it's a juvenile, parents will take the patient, the patient decides then at that point they don't want to be transported. And so there's the entire list there that we see that happens in the field with respect, do we transport them or not? And then those that aren't transported are broken down pretty clearly, I think. Let me scroll down a little farther. And last is the Minnehaha County Sheriff's Deputy Program that we have for the EMT basics out there. The calls that I reviewed and we compiled, it's about 55% of the county EMS calls where a deputy arrives on scene. Considering there's one or two per shift, I think those are good numbers with respect to percentages. The calls that I reviewed are those that during that period included 2 cardiac arrest calls that the EMPs were on, that they rendered care, whether they applied the AED or iGel or rendered some sort of immediate care. 3 trauma calls, the reports I received, they rendered care. There was a general medical call. I believe that this program is very valuable, and it continues to be another means of early assessment and the ability to treat, especially in these more rural areas. And, you know, we talk about ALS and BLS. Before you do any type of ALS care, we have to do basic life support. We've got to airway, breathing, and circulation, make the scene safe, get the dog out of the way, those sorts of things. And these EMT basics, I don't want to call them basic EMTs, but that's our designation for them. They've been very valuable since that inception. So with that, if there's any questions or comments, again, this is the first time report that I've done it this way. I still think there's lots of capacity and ability to enhance the report. Up next is we're going to get together with the primary service areas in a user group, if you will, so we can start a QA process. Also, what I look at in these call runs are interventions, procedural types of things, and I look at the attempts and successes, and what we'll do going forward is trend those out. If I see a particular trend in an individual medic, which is something I've never ever been able to do, then we can pull that in and see if there's any need for remedial training or just for open discussion. Hopefully at some point we'll be able to have a skills rodeo, and whereby the service can get together and we can practice certain skill sets through a simulator or mannequins, what have you. So that's what's kind of up next in terms of what we plan on doing. I think there's been a lot of work, and I think that we need to recognize those that were involved in all the work groups. Lynn has done a great job organizing and keeping this all together. We've got commissioners that are interested, and I'm very impressed with all of that and how that's came together. As added commentary, I was invited to sit in on an EMS Strategic Future Planning Committee. And that's a cross-cut of individuals from the state of South Dakota, good people, all interested in improving the EMS system. They all suffer the same sorts of problems, workforce and funding. You know, funding has been so sporadic, and it floats to the top. We have an incredible volunteer system. We had discussed the other day about one system, agency, was recognized as Agency of the Year in terms of how it provided care to the community, and 2 years later just disappeared. They just lost their service volunteers. And the funding, you know, the majority of funding in rural ambulance services now is donated labor. It's our volunteers. Funding, again, is so sporadic. In the early 80s, Governor Mickelson provided $250,000 a year to ambulance services throughout the county, or throughout the state, that lasted for 3 years. Governor Janklow took some money from the horse racing and give the services, I think it was $7,000. But the federal system, they only fund transport. They don't fund the care side. And that's, if you look at 911, these services have to maintain compliance. Their drugs have to be kept from expiration. Their equipment needs to be updated, and all for, at least on the CMS side, for non-reimbursable care that they provide. There's 131 ambulance services in South Dakota, and 73% of them answer less than 500 calls per year. One thing I found was very interesting, and 57% of them have no hospital in their area. But what I found, which something I didn't know, is there's ambulance services along the interstate corridor that have a good service, but seldom do they transport anybody from their community. It's all tourism, motorcycles, accidents out on the interstate, and it gets one to think about how could one capture some funding that's more and above what they're able to do themselves. So I'll keep you posted on that. We will meet again the first part of December. I'd bring that back. But also what I'm bringing to that committee is what this system has done, whether it be through the Fitch study, a collaboration, the whole EMS community gathering and participating in relief for a big problem that's dear to all of us. I think a goal of mine would be to make sure that EMS is recognized as an essential service. It's just like our fire department, our law enforcement. It's a very important part of our everyday community lives that we expect it to be there. And so my hat is off to the volunteers in the system as well. It's tough. It takes 100 people to come up with one volunteer. So those stats are pretty staggering. With our millennials coming in, it's difficult to get people to understand what a volunteer ambulance job really means and entails.
Thank you, Dr. Luther. Questions, Commissioner?
I just want to make, excuse me, a comment. Somebody had to coordinate all this after we approved the Fitch study, and the Fitch study was controversial, to say the least, but I'm glad we moved ahead with that. The real issue is that the communities themselves and those medical directors in those communities and the report that we got from the Fitch was the guideline to get some of this kicked off. And it was amazing when we set up those 3 work groups, the participation from everybody, almost 100% of the rural communities came together and came up with conclusions, changed the ordinance, agreed with the ALS, BLS combination. I mean, the quality assurance kinds of things that we questioned or asked more questions about at the beginning have now all been, frankly, addressed. And it's heartwarming, actually, to see how everybody in the county put away their differences, if you will, and participated in this. And that was, part of it's because of Lynn's leadership, but part of it, a lot of it, was because you grasped this issue that the Fitch study published and said, this is how we can use this to make the roadmap smoother. And thank you for that time.
Kursky?
Yeah, thank you for the report, and it's sobering or maybe even scary when you think about driving across our state or any state and how dependent you are on those volunteers or those people. If you're on the interstate highway system, you're probably feeling pretty safe, but if you take a road out in the middle of nowhere, you don't consider what happened if I drove off the road or had something happen to me, so it's kind of sheds a different light on it. Question is, remember from the Fitch study, and I don't know if this is something you look at when you do the quality analysis, but they talked about the outcomes, like of cardiac arrest and, survivability rates and that type of thing. Is that the type of thing that you look at, or is it just the response times and that type of stuff?
Were you at the state meeting with us when we were?
No.
Because that is, that's an extraordinarily awesome question. These volunteers want to know outcomes, It's not the easiest to extract that data. We have some inroads in the city that we're able to do that, but one of the things that is an item that needs to be addressed is we want that feedback. We're going to work on that in the county. Hopefully we'll have some success with that. It's going to take this medical advisory panel, our docs that have agreed to help us out, maybe. Sometimes we can call the facility, but it's a little bit of an apple picking high up to get that, but it is very important to these providers, our EMS providers, to get that information. They want to know what happened to that patient. So that's an agenda item that will be one of the first things we want to address. How we get it, if we have to longhand it, we will. There are some systems that actually, the heart attack calls, we call it the STEMI, will provide back the pre-angiographic pictures with the post-stenting pictures, so you can see that on a map so that these providers can look at that. It doesn't happen always. One thing that we do too in the city is we do a multidisciplinary QA review where we invite everybody in from the hospitals. We'll select calls, whether it be trauma or medical. One month it might be one of the critical access hospitals. The next month it's the other, could be medical trauma again. We'll try and do that in the county once we get the herd together, and we'll reach out to those facilities. And in our community, if it's a major trauma or a major medical problem, it usually goes into one of these destinations in the city, which should be easier for us to get that information. But it's an awesome question, because that's something everybody wants to know.
Thank you.
Additional questions?
Madam Chair.
Commissioner Barrett?
Dr. Luther, I got to say thank you so much for this report. I think over the years I've been here, we've gone from the Stone Age to interstellar travel as how the report looks and stuff. And I feel, I had a couple questions earlier, and when you went on to talk about the conference you were at, you basically answered them. And I look forward to working with you going into the future here to make things even better.
And just jump on the bandwagon with everybody else. Thank you for your leadership. Lynn, thank you for your leadership in this. And without the volunteers, we couldn't do any of it. So thank you. I know everybody put in a ton of hours on making this work. And Jeff's right. This is a long ways from where we were 5 or 6 years ago. So it's wonderful. So.
Well, thank you for that, Madam Chair. And I think, again, this is it's not a slice of the pie anymore. We're ingredients in a soup. And so recognizing that all of that's went into this is important. So thank you.
Thank you. We'll go on to item number 12, which is consider recommendations for renewal and issuance of the surface ambulance licenses in Minnehaha County for 2019 and 2020. Lynn.
Good morning, Commissioners. Linda Young, Emergency Management. Before we get to the main body of the memo, I was asked just to provide a brief history on our rural ambulance services. So they were all formed around 1970 and everything. As a result of communities were growing in our area, EMS was just getting started. One thing to notice at that time, or to note at that time, is the initial training for an EMT was 24 hours. So after 24 hours of education, you got to hop onto the ambulance and go assist your fellow citizens in times of need. They went through that for many years. That really worked and everything. But once we got up to about 2000 and everything, the rural services were identifying some of these gaps that we're already seeing with training issues, with funding issues, and then also with staffing issues. So in 2001, the Rural Ambulance Association, Metro Communications, formed a task force and recommended to the Commission that they develop and implement an ordinance governing rural ambulance response in Minnehaha County. Minnehaha County is one of the only counties in the state that has an ambulance ordinance. And the state really doesn't identify through statute who's responsible for EMS. It's just a out there in community type of thing. So, so that was in 2001. In 2002, after that recommendation, the county adopted on March 19th the first surface ambulance ordinance, and then the quality assurance process was also implemented with Dr. Luther in his reporting process. Through those years, the county also started to fund rural ambulances, including Garrettson, Del Rapids, and Humboldt within their budget. And so then we moved on to about 2007. At that point, then Commissioner John Peckus led an additional Commission Task Force on Rural Ambulance. The task force recommended the formation of ambulance taxing districts because once again, the current funding comes out of the general fund. And this was a way, or at least a method to do that, is to fund a more stabilized one. So that would be like a road district or a school district or any of those special districts. In 2008, that vote actually failed. A 45-57 that was held up in January on the coldest day of the year. I remember being up there with Auditor Roust at that point. So the county continues to fund at different funding levels, Garrettson, Del Rapids, and Humboldt. And just as a note, in 2012, the average cost to train a volunteer was about $750 to $900, and then the class requirements were 160 hours of training. So in a short period, you'll see the requirements went up, for those things. So the county continues to fund for the next several years as it does today. In 2015, recognizing the fact that it is difficult to maintain, and recertify EMTs, the county authorized $10,000 to be utilized for training of rural volunteers, and they would pay for up to 50% of the cost of an EMT class based on a method that they sent out. So you had to be part of a service, you had to take the class and pass, and then you had to stick around with the service for a couple years. So back in late 2016, as a result of all the things that were going on, the struggles that were out there, the county authorized and contracted with Fitch and Associates to implement a EMS study. We've heard a little bit about that. Fitch completed a study of the rural EMS system within Minnehaha County and had 26 areas of improvement. As you've heard before, several working groups were identified, including the governance training, electronic patient care, and then a medical board. And they were staffed with representatives from all of the rural services, communities, commissioners, Dr. Luther, myself, and other volunteers. And the goal, once again, was to implement the Fitch study and to provide a better level of response for the citizen needs. So I would also say that the Fitch study is what led into the new ordinance that you have. Maggie Gillespie with the State's Attorney's Office was an integral part of that. One of the things that we wanted to do in the Fitch study is to have our ordinance reflect what state statute indicates, both in response times and cleanliness. There's a lot of state statutes that we utilize, so our rural services don't have two different levels of needs that they have to satisfy. If they can satisfy the state requirements, we should be able to satisfy our requirements. And then one other thing to note in 2018 is HB 1076 passed, which allowed townships officially to fund EMS. Before that, they were allowed to give donations, maybe, depending on who their legal advice was and everything. So this officially allows them to do that, and then for those townships to become a official part of the funding mechanism that funds rural services. So in August of this year, the ordinance was approved by the commission in March, and then in August of this year, all of the ambulance services submitted applications for primary service areas, and that's where we're at today, is they've submitted those applications. As part of that application process, their ambulances were all inspected. We went out to make sure that they conform to the ordinance. We asked for additional information within their ordinance packet, and all of that should be available if you desire through Olivia in the auditor's office. There's a whole lot of it, but if you choose to look at that. So where we're at today is both Dr. Luther, myself, and Carol Muller met and reviewed the EMS application packets, requested additional information if we needed it, and then looked to make sure that they conform to MC 31518. The information in there, like I said, is available for your inspection. So one thing to note in this ordinance package today is if you approve for the PSAs as identified here, you would approve for a 2-year term. And then you would also approve another term, or when we get to the end of the 2 years, then the EMS division, which is a part of the Fitch recommendation, Dr. Luther, myself, and all of those other groups would get back together, and we could re-award an additional 2 years without coming back for official commission action. So other enhancements that are within the ordinance and part of the new process here is there's also a process of emergency powers. We know that there's things out there that happen, and we have to be able to react to a county, to events in the community that might require that. So there's an emergency provision within there, and then the requirement that before the services are actually awarded their license, that they have to sign a county agreed upon mutual aid agreement and everything. We think that's important. The last thing that I would note is part of the report and recommendations, Dr. Luther and I also indicated that they are struggling. There is no doubt about it that rural ambulances, not only in Minnehaha County, but the rest of the state of South Dakota, are struggling financially, but are struggling more, and about this, they could answer this, but are also struggling finding people to do it. Workforce issues. Everyone knows that you have to do that. And in this case, I would remind you that as a, if I want to volunteer for Humboldt Ambulance, first I have to go spend $1,000 to do it, 160 hours of my time to do it, and then I still have to go to those calls and everything. So this is a huge ask for a volunteer. As a result of that, there's been some out-of-service times in Garrettson. Curtis is here to answer those questions, but we had a lot of discussions on, how come that happens? Well, it happens because of those things that we've talked about, out-of-service times. The thing I want to recommend Garrettson on is they're telling us that they're out of service and giving us those indications so that automatically through the dispatch process, if they're out of service, it rolls right over to the next mutual aid area. So that even though they're struggling, that's the best outcome that can happen in this time. But we need to know, or we need to advise the commission that there's those struggles and they're real. And how soon are they going to affect the rest of the areas? I think they're probably doing it already. It's just that they're managing it differently. But we have to be aware that those other struggles are going to affect those other communities. And typically, as I've seen in my career, it's kind of like a roller coaster, whether it's rural ambulance or rural fire. Some are better some years, some are less. That's just the way it is. So, but otherwise, I'd be happy to answer any questions. Just for your review, the PSAs are also attached. If I can get it to here, here's the mutual aid agreement, which once again is nothing new to the service providers. They've worked great together. There's also a list, call history here of 2016, 2017, and year to date. So as you can see, they're all right about in line and trending and everything, but it shows the need for rural services within Minnehaha County. And then the discussion on some out-of-service times, and there it is. I just gotta, okay, so that would be the PSAs that that they have historically been assigned to, and it only makes sense to assign Humboldt to PSA 3, Dells to PSA 1, Jasper 4, Garrettson 2, MedStar from Brandon 5, and Paramedics Logistics, number 6. And just to answer a couple questions too, one of the things that we wanted to identify, or at least change in the ordinance for this, was the state response times now mirror the county response times. They're together, Commissioner Karski. That was one of the questions you have. And a lot of them are strictly just affected by geographics. I mean, Humboldt, as you can see, runs the entire western half of Minnehaha County, and depending on staffing, time of day, and call type, it just takes longer. It's part of the county system we have. But I would also tell you, there was one question asked is, depending on where you're at, you're going to get services quicker. So if you're in the community of Hartford, and there's a call for a heart attack or any one of those significant calls, you're going to get a fireman, you're going to get an EMT deputy, and you're going to get the ambulance from Humboldt. That's the same if maybe you're at the Buffalo Trading Post up at north of Humboldt and west of Colton. As soon as that EMT deputy program, as soon as that EMT deputy is notified, he's headed out there. So we have implemented, you have implemented and encouraged several layers of response. And what we found, and I think Dr. Luther will echo this, is that's the best outcome that we know of today. is to get several layers going, and it's probably, all those numbers you saw are probably greatly reduced if we would add in those other components that are in our EMS system today. So I'd be happy to answer any questions, but based on the recommendation, the commission, or based on Dr. Luther, its reviews, and myself, we would recommend the awarding of the PSAs to the following agencies as listed within the memo.
Okay. Questions for Commissioner Karski?
Yeah. I'm new to this ambulance thing.
no
and
problem.
I think it would have been real interesting to be involved with Judge Peckas's study 10 years ago
Yep.
and what they did, but there's no state statute that says if you live in a farm out rural wherever, that an ambulance has to be, what makes an ambulance be dispatched? You fall off a building, you're having chest pains, whatever. I mean, how, there's nothing that says this has to be done by this provider, or how does that work? I mean, I know if I live in Sioux Falls and I dial 911, Sioux Falls has an ambulance contract and Paramedics Plus is gonna come. But if I'm out in the middle of nowhere, how do I know who and what's the requirement that somebody show up and take care of me?
That's a great question. And in Minnehaha County, that's why we have a surface ambulance ordinance, is to ensure that all citizens within Minnehaha County are going to receive those services that we feel are necessary. Out in other parts of South Dakota, unfortunately, there's some areas where you're just on your own sometimes, and it's better to load up your loved one, you're injured or whatever, in a car and start headed to town.
So it takes it to the next level. I mean, if you were to have an ambulance service and to provide service to an area, you're probably gonna need at least 4 3-man crews to provide an ambulance service. And if you look at what it takes to, pay a paramedic, I mean, you're probably looking at $750,000 a year just for a 12-man crew to provide 24/7 service. That does not even include the equipment, the vehicles, the facility. I mean, it's expensive. And when we look at 6 areas, I'm probably gonna make somebody mad here, but what is our budget for in Minnehaha County for the ambulance service?
The county provides $50,000 for areas 1, 3, and 2. That's divided equally, and that's basically a readiness fee that ensures that they're ready. As far as the rest of the dollars, they also get dollars from townships and the communities within them. The rural ambulances have agreed that they'll charge their their response areas or their PSAs a set number for per section, and that's $100 that they ask their townships to do that. And that wasn't allowable until last year legally for the townships to do that. But as far as, I'll echo what Dr. Luther said. The biggest component of this is volunteer labor, and they are volunteering and giving back. If we or someone else wants to do it, especially on the 911 side, just answering 911 calls, I'm sure these providers back here will tell you there is no way that they cover cost with billing and all those other ones. What the exact budget amount is hard to determine because of the for-profit nature of 5 and 6. But I will tell you that they will tell you this is not any place where you make money, and that's because of no pays, Medicaid, Medicare reimbursements, and a whole lot of things that do not make ambulance services profitable at the 911 call level. But you can sure ask them to provide that information.
It becomes more and more apparent we don't thank them enough.
Commissioner Bender?
Well, and just to kind of follow up on that, my understanding is there's really no governmental entity that has the statutory responsibility to fund ambulances. Is that correct?
As we found it and through the reviews for through the legal process, there is no one that's identified to do it. Now, what I will tell you also is all counties around Minnehaha County do it differently. They all choose to do it differently based on a lot of things that fit their county and everything, but you're correct, Commissioner.
Commissioner Barth?
Lynn, do we have numbers on what the outside funding is for the volunteers yet at this point? Are you researching that? Because I know there's quite a disparity between what some of the municipalities give their local ambulance.
Yep, so all of that information is provided within the annual budget packet that you would have. and we've been looking at that recently, and I can do that. But like I said, I think, you know, there is no one set formula that says this is what people have to do. We ask the county provides, at least for the three, the $50,000, and then we ask them to go out and do their due diligence. I think if you'll remember, Commissioner, one of the meetings that we had was a finance meeting, and at that point, Del Rapids, the city of Del Rapids says, well, we can provide more. So they're working with Garrettson to do that. The hard part is, like I said, is statutorily no one's required. It takes more money to do this every day because the workforce issues are there. So yeah, I'm not sure if that answers your question, but within your budget packet last year, they are all asked to provide that information.
Well, you know, I guess during that governance meeting or whatever it was, there was quite a disparity between some of the communities. But going back to just our own regulations, we require 2 EMTs to go on every run. Isn't it the state only requires 1 and a driver? Isn't that right?
Yep, so the state recently
So
changed.
our requirement costs them extra.
It does, but I think the benefit, and this is something that they requested, is we provide a higher level of service. So sometimes when you're going to provide a higher level of service, it costs more. Now, if that's something that we want to, on direction of the commission, go back and look at, is that second person just needs to be an EVOC qualified person, or what the state did is change it to EMR, a lower level of EMS knowledge, training, and equipping. We could choose to do that in the future. That hasn't been the recommendation yet from the rural services, but I think if they bring that forward, that's something we could look at. I would probably tell you that they're still going to run into workforce issues just finding those folks.
Are we, do we have other requirements, you know, for example, how new their truck is or how much tire wear there is that are costing them extra money?
I don't think so, but once again, that's something for they would answer. I think they would have brought that up. The only one we've had real discussion on is the 2 EMTs in the back of a unit. And I would tell you that if the one thing that I would really be hesitant of, and I know we're tracking this now, is ALS interventions with paramedics, but if we will go and require a paramedic 24/7, each one of these services, I think that would be a game changer financially and workforce. I just don't think that we probably should do that unless there's strong recommendations, and with strong recommendations you better have strong financial backing, because it's going to cost more money. It just will, and those workforce issues will come into play.
Commissioner Bender?
So kind of getting back to the licensing.
Yep.
The issue about the Garrettson ambulance
Yep.
and the fact that they were not available for calls those different times, I would like some more information about what the plan is for the future, that's not going to happen. Is that something that?
Yeah, I'll ask Curtis to come up.
Okay.
He was on a call earlier today and everything, which shows, but he is here now. But Curtis from the Garrettson ambulance can address those issues directly.
Thank you.
Curtis Nelson, Garrettson Ambulance. So we've done a number of things. This summer is probably about the toughest period that we've had in staffing, and we've made some management changes earlier this year. In the past, we hadn't been focusing as much on workforce development as we should have been, and so we've changed, our makeup of our board has changed. A lot of our procedures we've reviewed. Since this summer, we've brought in about 6 or 7 new people. We're training them up. Several of them are now taking call. And we've also, looking longer term, we are starting an EMT class in January. We have some interest from the community of people who want to become EMTs. We're working with the city on helping to fund that so that it's not such a burden on the individual to get that training. And so we're hoping to add some additional people in the next year based on that class. We have been in service continuously for almost 2 months. I think it was right at the beginning of September was the last time that we had a period that we were out for a few hours. The periods that we've been out have been sporadic, have been usually short. We try to maximize as much time as we can to have coverage. And whereas some services will try to just kind of float it and hope that somebody shows up if they do get a call, we feel that if we know that we don't have a crew, that we want to make sure that the next service comes quicker. So just because of our staffing model, we don't usually do that. So we are calling attention to ourselves by calling Metro, let them know that we are out of service. But we feel that's what's best for our patients.
Okay, so, I mean, one of the questions I had was because the numbers that we had showed that the last time you're out of service was September 6th.
Right.
And so you haven't had any other out of service since then?
Not since then, no.
Okay. And do you feel like you're adequately staffed right now, that you don't anticipate that being an issue going forward?
I believe so. I can't guarantee that it won't happen again someday, but we're in a much better position than we were this summer. Like I said, we've had new people that we've brought in that are, some of them are still training, some of them are newer EMTs and need a little bit more ride time before they're ready to take calls on their own. But we are getting them in, we're riding them with more experienced people. They're getting that training. And so like I say, we're in a much better place than we were. And I think that'll continue to improve going forward.
Okay. And can you just clarify, particularly for the viewing audience, so when you're out of service, the folks in your service area were adequately served? There weren't people that ended up not having somebody come to their...
So if we know that we can't respond to a call, then we'll notify Metro Communications, and that way we don't get dispatched and then wait for somebody to answer and nobody answers. Metro has a protocol for how long they wait before they'll dispatch a second time, and then they'll automatically send mutual aid. So rather than wait that several minutes for nobody to answer and then they start mutual aid, then if a call comes in and we know that we're out of service, then it automatically goes, the next closest agency will get dispatched to it, so there is no delay.
Okay, thank you.
Thank you. Commissioner Benega?
Kurt, if I can ask, just to follow up on that, when you were out of service, do you know how many calls that you received that went to mutual aid, so to speak, that had to be filled by someone else?
I don't have those numbers, no.
That would be, I think, important information when we get to that point.
I don't know if Metro has those or not.
Justin Faber, Image Communications. In terms of their out-of-service times, it's less than 5 calls that they
Okay.
had total for the entire summer that rolled over to somebody else. What was interesting when I looked at the calls, the total response time from call to unit on scene didn't actually change. It wasn't longer because, excuse me, because we had to go to mutual aid. The reason for that is that MedStar covers most of that territory as a mutual aid, and they're not a volunteer service. So they were able to get somebody started right away. So we don't have that built-in, have to drive from the home to the ambulance station. So it's not, to the person who's calling 911, you don't see an extended delay. But certainly it is a burden on MedStar because we're taking a resource out of a different community. So I think we have to thank them as well. Thank you.
Thank you.
Commissioner Barth?
So I actually have a memory of attending Commissioner Peckus's task force meetings, and I see other people in the room who were in those meetings and involved. And you know, it's a little bit of a convoluted history back in those days because I think you know, in 2000 we gave ambulances $5,000 a year each, which they were to save towards a new vehicle. But starting in 2005, we gave them $45,000. Then it went to $90,000. Then it went to stayed $90,000. 2009, it started to reduce and went from in 2010 to $80,000, 11 to $65,000, and for the last 8 years, it's been $50,000. And so, in a sense, back in the time when the vote failed, we knew there were other assets that they could call upon, whether it was the townships or the municipalities in their area. And so the fundraisers, I know I've been to Humboldt fundraisers before, and when can I get a ticket? Let me know. The fact is that I think the volunteers have really stepped up their funding efforts. We've kind of starved them a little bit, though, and I think we should look at least assuring them that for the 2 years of licensure, they don't have to worry about getting cut additionally, and that as we look at our budget going forward, that we try to find them additional funds. Anyway, Lynn, were you at those task force meetings?
Yep, a long time ago.
Lucky. Well, being younger than me, you may have a better memory, and again, we didn't have the responsibility then, but the fact was that there were not enough able-bodied people in some of these small communities during the day to respond, because everyone was working in Sioux Falls, or else there might have been 4 or 5 guys with, sitting at the town bar looking at a bottle of Bud, not competent to go on a call. And so we started funding it additionally. I don't know, I think we need to revise our support going forward and work with the townships, the municipalities, and the providers to more fully fund them.
Lynn, did you have a comment?
Yeah, you know, an important part of this, obviously, is the EMT deputy program from the sheriff's office. So if you would allow, I'd just ask him to come up and, you know, remind the group of how important that is, all the training that's been done, and, you know, hopefully with our reorganization within the sheriff's office and my office, we can reach some of those goals. And look, because, you know, the one thing I'll tell you is today's model may not be something that we can sustain for 5 or 10 years. I mean, we'll get the EMS governance group together after this, but we also have to be looking forward thinking. But I would encourage the sheriff to come up and, you know, just talk about that if that's available. So.
Thank you, Lynn. Morning, Sheriff.
Morning, Commissioners. So, a couple things, and appreciate Dr. Luther's presentation. Is pretty informative, and I wanted to mention about the EMT program. That was actually initiated back in the days when they were doing the ambulance studies, and Commissioner Peckus and this, to try to help out our rural partners because of it being very difficult, in particular during the daytime, to get, you know, EMTs on a scene right away and provide that essential basic life support until more advanced equipment and personnel can arrive. I'm actually sending out today, we're going to send to our deputies, all of our patrol deputies, to see how many additional deputies may be interested. And once we establish that number, we're about a third of our patrol deputies now are EMT deputies. I'd like to beef that up. There's some minimal budgetary impact, so before I move forward, once I find out how many additional ones that we could put on, I'll come to you. But I think it would be good if at least half of our deputies were EMT deputies, and even more, because sometimes it takes the rural ambulance a little bit of time to get there, and if we can get some basic life support provided until they get there, I think that's a good thing. The second thing, just a real quick item, but it's not a small item, is, as you know, Lynn talked about the reorganization where emergency management is part of the sheriff's office now. I'm learning more about the ambulances more than and the ambulance funding in particular. And Dr. Luther pointed out it's a statewide problem. I think it's a nationwide problem. The fact that our rural ambulances are having to pay people to take these calls, so that they really are, you know, it really is a paid service because you just can't maintain that full-time volunteers for some of those critical positions that require all that additional training. So it's costing them money. They're doing fundraisers. But as I'm looking at, I asked Lynn to provide me with just what you asked for, Commissioner Barth, and that's how are these each of these 6 areas funded? And they're all different. You know, some get funding, significant funding from a city. Some get no funding from a city. Some get funding from townships, some get no funding from townships. And so one of the things I talked to Lynn about and Commissioner Bender about, is the need to probably put together a group within the next month or two as we start looking at next year's budget and try to understand better what that funding mechanism is. Maybe meet with some of the cities and townships to encourage that funding, the fact that they have the ability to do that now, so that we can you know, maybe provide a better standardized way that these districts are funded. If I take Del Rapids, for example, where the city pays I believe they get money from the townships, and then they get money from the county, in comparison with Area 5, which would be Brandon, where as I understand it, the city doesn't fund it, the county doesn't fund it, and the townships don't fund it. And so I think it's time to take a really close look at that. I would hope the commission at some point could, you know, put together a group for us to just look at that and try to maybe make some recommendations. We'd involve all of our partners in that area, because my goal would be that, you know, 2 years from now that they have sustainable funding, and that they feel that they're not, you know, going to do what the with the company of the year, you know, that had to fold because they couldn't provide the support because they didn't have the funding. So it's a quick item, but it's a big problem, so. Any questions for me?
Commissioner Barth?
Thank you, Mr. Sheriff. You're a wise man. So, do you know if the Highway Patrol has their folks trained on life support stuff? I mean,
I do not.
and now, do you know if I heard, and I don't know if it's true, that the state uses highway money to pay for the Highway Patrol? Is that true?
Yes.
But we don't get to, huh?
We can't because the state law reads that the highway patrol is funded, or that highway funds can be used to build, maintain, and supervise the roadways. That's how the highway patrol is funded. It says the county highway funds can be used to build and maintain the roadways. The word supervise is not in there, and so we're not able to use any of the highway funds.
Commissioner Bender?
This is not so much a question for the sheriff as it's just a comment. We did have an opportunity to kind of visit about just some of these ambulance issues that we've now dealt with for a couple of weeks. And, you know, we're here today to talk about licensure, which is really different than funding, but, you know, funding is what makes the whole world go around in just about every area of things that we talk about. So I would be, after we get through the licensing, I would be supportive of trying to put together a committee, as the sheriff has mentioned, to try to do a little global dig into ambulance funding now that we've done some of these structural changes and been able to focus on some other areas of the Fitch study. I think there are a lot of questions that I would have that, you know, we're not going to be able to answer today or tomorrow, but if we took some time before next year's budget to really do a little deeper dive and try to make sure that that we are doing our part and that we are, you know, trying to make sure that funding is allocated appropriately. I think that would be a good use of our time.
And as I understand it, this group would probably want to meet sooner rather than later because township funding, I think they have to have theirs done by like February for the next year's budget, which would be for 2020. So, I mean, if we want to have those discussions, especially if we want to invite some of the townships to the meeting, we probably would need to do it fairly soon. But thank you, Commissioner.
I think under old business today, we will discuss and give staff recommendation, or marching orders as how to move forward with this project, since we are supposed to be talking about licensing, which she's right, it kind of folds into everything. But I think under old business today, we'll have that discussion about what we can have staff do to move it forward.
Okay, thank you.
Lynn?
Okay, so getting the hint and needing to move along. If there's any direction from the commission, otherwise, if there's a recommendation to award the primary service areas as indicated within the memo, I think that's
my
probably the
motion,
next step.
to allocate those districts as recommended in the memo.
I would second that.
Motion is second. Additional comments? All those in favor say aye.
Aye.
Those opposed, same sign. Motion passes unanimously.
Thank
Thank you,
you.
Lynn.
Thank you.
Item number 13 is consider a motion to authorize the Highway Department to purchase RTA fleet management software. DJ?
Morning, Commissioners. DJ Boothie, Highway Superintendent. I had prepared about a 25-minute presentation with a software slideshow, but I think I'll
Want us to
I'll
defer
use
to next week?
No, I don't. Just have a few comments to make. The Highway Department has been investigating a fleet management solution for about a year. For the Highway Department, what fleet management means is maybe a little bit different than some of the conversations I've heard about fleet management from the Commission office and other departments in the county. For us, utilizing a software solution will provide a centralized database of parts management, parts inventory, asset maintenance schedules, task management tools, fuel inventory integration. And ultimately what that can do for us is hopefully improve labor productivity, allow us to gain some deeper insights in the business side of our fleet. Right now we're using a whole bunch of different spreadsheets. And I'm not trying to fault our staff or anything like that. Our staff does a good job with this, but it's several different spreadsheets that we're trying to manage a lot of equipment with. And so using a software that's designed specifically for this purpose would just be a lot more efficient and probably result in some better long-term results for our fleet. At the end of this year-long process, staff had made a recommendation to move forward with a hosted software program called RTA Fleet Management Software. The upfront cost, and this information is kind of summarized in your packets, but the upfront cost for this is about $24,865. And then following that first year cost, there's a quarterly hosting fee of $1,065. The upfront fee, it covers software installation, users licensing, fueling system interface, 3 days of on-site training, 3 days of training for a person to go to Phoenix to their headquarters where the software is developed, data conversion of existing information, handheld scanner hardware and label printer, and then the quarterly fees that will cover technical support, software updates, customized programming services, and the actual online hosting fee. This is really just as much of a turnkey solution as you can get for this type of software purchase. Budget-wise, the fleet management software is not an itemized line item within our current budget, but it certainly is something that we're able to purchase. We have budget available for it in this budget year. So I would like to request a motion to authorize the Highway Department to purchase this fleet management software, and I can stand by for any kind of questions that you have.
Questions for DJ? Commissioner Barth?
I'd make a motion to approve. I do have a question.
I'd make a second. I have a comment.
Okay, Commissioner Barth?
Would we be able to use this on other vehicles within the county or just highway vehicles?
Certainly. The way that the pricing is structured is you purchase a certain number of units. A unit would be a vehicle, and then when you have that unit authorized on your software licensing, you input the data, the maintenance schedule, the information that you want to track for that piece of equipment, and then you're able to use the software for it.
So going forward, it would be only new vehicles purchased after the acquisition of the software?
We're paying a fee for them to take all of our data from our existing fleet and put it into the software program. And I mean, we could do that manually, or we can pay them to do it either way.
If I may, so we just are recently looking at getting a pickup truck for facilities. What would we have to do to get that pickup truck to be managed?
Simply include that pickup's data with the data integration that we provide to the software company.
Thank you.
Commissioner Karski?
And the cost per unit on that, DJ, do you remember that?
It's less than $15. I think it's like $13.50 or something like that.
Because you show 200 units, and I mean, that's generators and all sorts of different equipment,
Most
correct?
things
It's
with a
not-
motor.
You don't have 200 vehicles, obviously, in the highway department.
Correct. Like I said, it's pretty much anything that has a motor.
Okay. And the other thing that it includes when we met is the pump and tank fueling, for all the other departments, because people buy their fuel from the highway department, and this allows, and from what I understood, the tracking of that got to be kind of complex, and this really simplifies it.
Yes, the actual hardware and software of the fueling system itself is not included in this dollar amount. That's going to be an additional purchase that we have to make anyway. But this does include the integration on this software package with that fueling system. Okay. And so our current system, other commissioners, you might not know about this, we have a computer in our department that literally cannot connect to the internet. We can't update it because the software is so old, and if we would plug it into the internet, it would crash and burn and not work. So we have to upgrade our current fueling system and computer course, and so that will hopefully integrate seamlessly into this software, and then we'll have all kinds of fueling metrics that we can track with our equipment, which right now we're basically not able to do.
Additional questions or comments? Okay, we'll have a motion and a second to approve. All those in favor say aye.
Aye.
Aye. Those opposed, same sign. Motion passes unanimously. Thank you, DJ. Item 14 is a brief update from HDR Engineering on the Maple Street Park Street Corridor Study. I guess it's you again.
Commissioners, earlier this year, we began a corridor study along Maple Street and Park Street with the DOT, the City of Brandon, and the City of Sioux Falls. Up to this point, we've been working with the study advisory team to develop project methods and assumptions. and our consultant HDR Engineering is here today to brief the commission on where the project is at and where it's going. And so Paul Sanow and John Wiegand are both here to make some comments and also stand by for any questions that you have.
Good morning, Commission. Paul Sanow with HDR Engineering here in Sioux Falls. DJ actually stole my line. I was going to say we had about 20 minutes of technical information prepared for our study today, but I do have John Wiegand here. Actually, we just want to go over just a real brief summary and an update on where we are with this study currently. If you do have some technical questions in regard to the traffic and some of the traffic data, we're still in just the beginning stages of this process of the study itself. But John would be more than willing to answer those for you. He's very good at what he does. He's our traffic engineer, analyzing the traffic data that we're taking over this corridor. The project limits, or the corridor study limits, are from Veterans Parkway to Split Rock Boulevard, South Dakota 11. Veterans Parkway is referred to as Highway 100. That is currently still under construction. With the construction of Veterans Parkway to Maple Street, this corridor, and it's not just because of the construction of Veterans Parkway, but as the city of Sioux Falls continues to grow to the east, and as Sioux Falls also continues to develop, as you've seen with the recent construction of the Brandon Valley Intermediate School, it just creates that pressure that we see in these east-west connections between Sioux Falls and Brandon that you're all very aware of, with the news of the commuting traffic that travels between Sioux Falls and Brandon on a daily basis. These east-west corridors become very important for commuters to continue to get to work on a daily basis. So what we've seen, just a couple numbers to give you to reference, are in about 2013, we were seeing roughly 300 vehicles a day. And if you want to just stay on that map, that would be fine for a minute, and I'll move on to. We were seeing roughly 300 vehicles a day between the stretch from 6 Mile Road to Brandon city limits on the west side, and actually continuing out to Sioux Boulevard. In 2018, in April, we just did a recent count. We're seeing roughly 900 vehicles a day in that stretch of corridor. So just for reference, the traffic volumes have tripled in that corridor in the last 5 years. So that's a testament to the increase in traffic volume that we're seeing in that corridor. So those are really the only numbers that we have right now. But as we move forward, we'll continue to update our traffic study. And I wanted to give you a date that you could write down. This is actually the first time that we've discussed the public meeting that we're going to have in public. And that will be November 27th, which is a Tuesday night at 6 p.m. And that meeting will be held at the Brandon Valley Intermediate School in the Commons area. And one thing we really wanted to hit on, and if you want to scroll down in our tasks that you have here at your reading pleasure when you have time, and if you feel this is our scope of work that we have, but I really want to focus on task number 5, the public participation portion of our study is something that we hold very, very important. It's a very important task. And that starts here, really meeting with the commission and the general public to introduce this traffic study and the importance of this study, and to make sure that we are encouraging everybody that is going to be involved and that has been involved in the past, and know some that have traveled this corridor numerous times and know people that live on this corridor. And it's important that as we are reaching out to the public, that folks like yourself, the commission, and others that are teaming on this project, that we have your support moving forward in discussions with even adjacent property owners, that it's in order for us to have what we consider a short-term or a long-term goal of potentially constructing a road on this corridor, there's going to be some impact to the adjacent property owners and to the general public. And so for, one thing that we look at that's truly going to be a key part of this project moving forward is identifying those tasks, or those tasks about the property owners and those stakeholders that are going to be able to provide that input. So we highly recommend and would encourage you to attend that public meeting if you could. In the meantime, if you have any questions, please reach out to us. I talked to DJ earlier. He has my business cards. And so if he can hand those out to you, if you have any questions, we certainly want to answer those as we move forward.
I would ask that staff put that date on the calendar.
Yep. And that date, like I said, we'll make sure that we get invites out. I just verified with the Brandon Valley Intermediate School late last week that we were actually able to use that facility. And so we're really excited about moving forward with this study. I know that it's been something that this commission and the county and the city of Sioux Falls, city of Brandon, the state DOT, Metropolitan Planning Organization, CCOG, it's been something that's been discussed for quite a while. And so I have some personal interest as well. I live on the west side of Brandon, so I like to travel this road every once in a while just to get an idea for, to get an idea for what the maintenance level is being taken care of, and that's certainly something that we need to take a look at. So I do have some pictures, if those are up,
Yep.
that I sent to DJ. There's some other stuff in these documents that I provided. That schedule is really the schedule of our overall study process. So if you want to take a look at that, you certainly can, but I really wanted to key in on that first public meeting of November 27th. The project understanding is also on the second page. That really summarizes the study. So if you want to take a look at that also and read it. This is an image at the top of what I would say is probably the largest grade difference in the overall corridor. Where it disappears there in the bottom is an actual low area that the township is doing a culvert replacement right now. So that road has been closed for some time. But this is looking back to the east towards Brandon. You can see the grade differences here. This is at a high spot where you have a driveway that's coming off of the gravel road. It's a 2-lane gravel road. Well, I'd say that it's sometimes a 1-lane gravel road. But this is looking to the east. If you go to the next one, this is looking back to the west. This was just a picture that I took. These are all pictures I took this summer. This is a bus stop location. One thing to consider in some of the safety concerns or safety things that we look at as the overall study is the intersections and where those locations are, and making sure that there's a line of sight that would provide that distance for stopping that would be considered safe. You can go to the next one. There should be 3 pictures, I think. Is it?
That was the
Oh,
third
was there
one.
3 of them already?
There's one there.
And then I also had a video, if that's available. Yeah, this one. Was this the third one? Okay, this first one here, I just wanted to show you. It's kind of hard to see, but the embankment on that left side of the picture indicates an area of erosion, but it's really almost a 1-to-1 slope. So even if we left the gravel road the way it was, to cut that back and to be able to get some sort of a slope that we can maintain, we're impacting those adjacent property owners. And that's really what I wanted to show in this picture, is again creating that communication and that dialogue with the adjacent property owners so that we're discussing those items. The video that I have, that's okay.
While we're looking for that, what will happen to traffic once it's paved?
So there's an attractiveness once there is asphalt put on this corridor. First of all, the grading itself, just creating those sight lines and the grades so that you reduce the slopes on the hills that you see currently, maybe filling in the low areas and decreasing the high points. It's inevitably going to increase. And I think that's something that we can't control that right now regardless. You've heard the numbers that I've told you. Just in the last 5 years, traffic has tripled. And we anticipate that to continue as Sioux Falls, like I said, develops to the east, and as the city of Brandon continues to develop as well, those traffic volumes are going to increase. One other item that we take a look at is the other east-west corridors, Rice and Holly, between city of Sioux Falls and city of Brandon. Maple Street, we also consider the traffic volumes on those existing roads and how the construction of a project like this, if it does move forward, what happens to those commuters? Do those numbers actually decrease on Rice and Holly, and do some of those commuters then transpire to to Maple. And so that is something that we'll take a look at as well. With Brandon Valley Intermediate School being recently constructed, a lot of those parents go east down Park Street out to Sioux Boulevard and then head north or south on Split Rock Highway 11 and go either to Holly or Rice or south to Madison. And so this would be a corridor where those parents that are dropping their kids off at the Brandon Valley Intermediate School and that Robert Bennis could then go west into Sioux Falls. It's a direct shot to 6 Mile Road, and as we continue west of 6 Mile Road with construction, it's that connection to Veterans Parkway, which is a very attractive connection between I-90 and the east side of Sioux Falls. Does that answer your question? It's a good question.
Did you want to play your video?
Yeah, can I play that again? Go ahead. So this was a video that I took. I'm actually standing up. That car, from the time that I saw it, is 4 seconds to the time that it goes over the top of that hill. And if you can imagine, this is at an intersection at Indian Hills Road, and not just vehicles coming out to the north, but also another vehicle coming from the other side. It basically is taking that 4 seconds and dividing it by 2, the amount of time that they have to react. And so that sight line is something that we want to consider in one of the safety issues. I just wanted to show that video to give you an idea of what we're dealing with out there.
Additional questions? Commissioner Bender?
Just a comment. I just want to thank you guys for this work. We had a chance to visit a little bit before the meeting today. I live just south of Maple. I told him I didn't let my teenagers drive Maple when they were still living under my roof, because at certain seasons that's a really tough road to be on. But it does, I think the growth in that area is inevitable, as your traffic counts show. And so I really appreciate you coming and publicizing this meeting, and hopefully we can do as much as we can to get people to that meeting, because it will have a huge impact on the landowners along Maple, but it's something that's probably been needed for a little while, and its time has certainly come. Particularly those traffic counts, once Highway 11 is connected to I-90, I see those just going up even more dramatically. So thank you for this work.
Thank you. We really appreciate your input, and we're really excited for the opportunity to move forward with this study.
I have a question. I think the one thing that I got stuck up on when I was reading through this was task number 10, which is documentation, which talks about conditions to last through 2030 and the future build conditions to the year 2045. Can you just speak to what that actually means? Because when I first read it, I was like, oh my goodness, they're not going to build till 2030, but I recognize that's probably not right. So
Right. No, John, if you want to come up, you can speak to the forecasted volumes on the road, but I'll just real brief, and like I said, I don't want to take too much time on this discussion, but DJ had actually approached us. We've been talking about the actual construction of the corridor of Maple Street between 6 Mile Road and the west edge of the city limits in Brandon. It's actually paved to the Big Sioux River Bridge. The maintenance necessary on this stretch of gravel road is significantly more for the township, and the burden that they have to try to maintain it at some sort of expected level of the commuters is extremely difficult. And a lot of those complaints that come into the street department in the county. And so they're dealing with the complaints, although this is a township road, as you all know. And in order to keep up, we either need to increase the funding and or increase the manpower that's put on that road. And so when DJ approached us about potentially putting a project together, it was, we need to grade this and pave it now, because we can't keep up with the maintenance. So we were talking 19, maybe 20 construction. So with that in mind, as we move forward with this study, the short-term goals would be to potentially look at what I would consider very conservatively a project within the next 5 years. I want to say 2. I would love to do it in 2, but 5. With that public participation and getting everybody on board, and the amount of impact that this is going to have to the adjacent property owners, and we don't take that lightly. So it's going to take some time to discuss this with the overall group that will be affected in this area. So to answer your question, that the future forecast, like I said, is something John can talk to, but as far as a project in the immediate future, I'd hope to see something within the next 5 years.
Okay, thank you. John?
Yeah, John William with HDR. And then looking out further, with the long-term goals, that one of the things that really was driving this study was not only looking at the county segment, but looking at the city segment and the city of Brandon's segment as well. And that's where we look at the 2045 traffic forecasts. And to forecast traffic out that far and what we'd be building towards, we use the MPO's travel demand model, and they have essentially all the projects that are planned between now and 2045 built into this model of the entire Sioux Falls area, and out looking out to Brandon and Hartford. And with that, it helps us derive some of those traffic forecasts and what we would look, we'd be planning towards and what we would design towards for a future corridor to help us gear, at least what we're designing towards, to gear towards accommodating those volumes out to 2045. So looking at that, a lot of the long-term goals, we're looking at the entire corridor, this entire corridor, not just the county segment, and that's where we're looking at in the long term. So,
Thank you, John. Additional questions? Okay. That was just a briefing update, so thank you. Thank you for
Thank
staying
you
for
very
our long
much.
meeting.
Look forward to seeing you at the public meeting on November 27th.
Okay, thank you. Item number 15 is consider resolution to set the weight limit loads on certain Minnehaha County highway bridges as recommended.
Commissioners, in 2018, we had our bridge inspections. We have about 198 bridges right now, and we inspected 92 of them this year. We previously came to you for a new bridge weight load resolution, adding one of the structures that we had found during the bridge inspections that was sort of a high priority. Just last week, we reviewed all of the inspection reports from our consultant, or with our consultant from the 2018 inspections, and have one more that we need to modify. It's not a real significant one. It's a bridge that's already posted, but we are going to need to change that from 17-ton and 27-ton single unit and combination unit posting to a 13 and 20-ton posting. And so a mild reduction in that weight load limit that already exists out there. And then additionally, we had one structure that was posted that we completed a construction project on for replacement this year, so we're going to be removing that posting. So the new resolution, it has 25 bridges on it that we're still recommending for posting, and can stand by for any questions if you have any questions about our load limit requirements.
Questions on the bridges?
Madam Chair, I would make a motion to approve these weight limits. At the same time, I think we should flash through a couple of the pictures that we have, and I would also point out, I guess I didn't know we had wooden bridges.
Those were interesting pictures. I have a motion. Is there a second?
Second.
I have a motion and a second. We need a roll call vote on that. As DJ's running through pictures.
Barth,
Aye.
Bender,
Aye.
Benega,
Aye.
Karski.
Yes.
Hiberger.
Aye. Motion passes unanimously. I was tempted to just go find it and go drive out there and look at it. You're right. Going over a wood bridge, we don't see many of those.
This
Make
is
your
our only
husband get
wood
out of the
bridge left,
car.
DJ?
Yeah.
This is the last wooden bridge that we have in Minnehaha County, actually, on the entire system.
Yeah. Some interesting
And
pictures.
so you can see there, this is a close-up picture of one of the wooden piles. This is actually not directly underneath the bridge. This is around the wing wall, it's called, on the side of the bridge off the roadway. But it is an indication of what kind of deterioration we could be seeing that's underneath the actual bridge in a spot that we are not able to see during the inspection. So that's the type of condition that we're worried is out there. And there is a little bit of redundancy in this system, so if one of those were to fail, the whole structure would hopefully not fall into the creek. It's a short creek, so hopefully that wouldn't be too traumatic for the person driving over that roadway. But we're trying to prevent that by reducing the posting, keeping the real heavy loads off of that structure, and allowing us for some time to be able to reconstruct that. This one is scheduled for reconstruction, I think, in 2021. And because of the new load limit posting that we have on the structure, we're more than likely going to be applying for one of the bridge improvement grants that's available, and more than likely be able to qualify for some funding for that. You can see there on the bottom of that pile right here, there's a big gap in the wood that there's not supposed to be a gap there. So
This bridge was built in the 1950s, wasn't it? And you think about a wood bridge built in the I'm pretty sure I saw 1950s. That's a long time for that wet bridge to survive.
Yeah, this bridge was built right in 1950.
Okay, that was
It's
a
a,
long
it's a
time.
36-foot-long bridge, pretty typical of what you might have seen on the township road system at that time. And you hear somebody say timber bridges, and maybe you don't think that we have timber bridges or had timber bridges, but they were pretty common back in that time. So all but one of them have been replaced in Minnehaha County, and we're looking to replace this one here in the next couple of years.
Thanks, DJ.
Thank you.
Item number 16 is consider a motion to authorize the application for the fiscal year 2020 contractual grant funding from the state of South Dakota, the Weed and Pest Commission. Ralph Hammer, good morning, Ralph.
Good morning, Commissioners. Ralph Hammer, Weed Supervisor. This is the ongoing, we've done it every year since I've been here. It's grant funding that the Weed and Pest Commission puts forth. And just asking for permission to sign it and go forth with it.
Make a motion to approve.
Second.
Motion and a second. All those in favor say aye.
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 Those opposed, same sign. Motion passes unanimously. Thanks,
Thank
Ralph.
you.
Thank you.
Item number 17 is consider a motion to approve a storm drain pipe change order in the jail expansion construction project. Carol Muller, good morning, Carol.
Good morning, Commissioners. Carol Muller, Commission Office. As you all know, we're building a jail, and before you today is some information about a change order that is coming forward, and we're asking for a approval from you for to approve this change order for up to $125,000 so we can keep the process moving. Joining us today is Lynn Remmers and Dave Van Nieuwenhuizen from JLG, who will take you through and explaining a little bit about stormwater and runoff, and we all know the importance of that, and a little bit of information about a pipe. So I'm going to turn it over.
Thank you.
Good morning, Dave Van Nieuwenhuizen with JLG Architects. We're with you this morning on two separate issues, and we'll kind of address them separately. One is the discovery of a storm sewer pipe when digging for foundations that was not located when we were doing the original survey. It's a private utility, and so we're kind of in a fairly desperate need to address that to keep construction going, and Jay Dunn and Henry Carlson are here to address that as well. The second is a topic that has to do with negotiations with the city on stormwater detention, on-site stormwater detention that had been ongoing for quite some time. Way back before plans were completed, the issue was not solved before the plans were fully completed and the project was bid, and now we have come to resolution with the city on how that will be addressed. And so I'm going to turn it over to Jeff Bolt from Sayer and Associates, and he's our civil engineer on the project, and he can probably give you a lot more of the technical details of this, but if you have any questions, I'll address those now as well.
Is there any questions? No? Thank you.
If not, Jeff Bolt will give you some information too.
Good morning, Commission. Jeff Bolt with Sayer Associates. If you could get our drawing up.
It's like a pot of coffee, it takes forever to microwave it, takes forever to boil, but it does come on here.
I think the first item to address is probably the stormwater requirements that the city of Sioux Falls has put upon us. As Dave mentioned, we were under the understanding that this was not going to be a requirement when we started our site design. And it wasn't until we actually completed our site plans and submitted them to the city of Sioux Falls for review that we got the review comment stating that stormwater detention and treatment would be required. Not a pleasant surprise by any means, given the complexity and compactness of this site. But it did take several weeks for us to work through the details of this stormwater detention system with the city and get final approval. As Dave noted, that didn't occur until after the bid of the project. That's why this is coming as a change order. What this system is basically comprised of is some underground plastic tanks that store the stormwater as it enters the inlets. It runs through pipes, enters this system, and it's stored underground and slowly released at a slower rate than regular runoff. And as I mentioned, that's a city requirement that's based on sometimes the parcel size that's being developed, the amount of added impervious area that is being added with the site, and sometimes it's based on area drainage concerns. If there's a lot of drainage issues in the area, the city will require this detention system. If you look at the drawing, it is that kind of large glob on the lower left side of the screen. That's where we were able to squeeze in this system. I guess I'll start with that, and if there's any questions on that component of this item.
What type of drainage was there before? I mean, we went from a parking lot to a parking lot in a building, so it was all Hart service anyway. So what was there in place before that's making this change necessary?
That's correct. We added maybe 3,000 square foot of impervious area, not a lot, given the scope of this project. I think this is more of an issue if there is existing drainage concerns in the area. That's when they will enforce the detention requirement.
Additional questions?
Madam Chair, you put your finger exactly on the issue there. We took out a parking lot which had runoff, and now we're putting in a building with a roof that will have runoff. But now we have to put in $100,000 of plastic barrels underground to store the runoff.
The other thing, and we want to be obviously a good neighbor, but I believe, and I could be speaking wrong, that the county doesn't have to comply with city ordinances. But we do want to be a good neighbor, so obviously we'll work through the issues.
Right. And I don't have all the specifics, but it's my understanding that there's two forms of treatment that the city's requiring here. One is for the quantity of runoff, and one is for the quality of runoff. Obviously, they want us to slow down the runoff from the site, and they also want us to treat it for sediment, to capture the sediment and make the runoff cleaner. It's my understanding that the quantity component of this is a city requirement. The quality is more of a federal requirement by the EPA. So to comply may be a two-part item there, where the city's requirement maybe we don't have to require or comply with, but the quality component maybe we do.
Commissioner Bender?
So, and I understand there's two issues, and you know, we've talked on our jail leadership committee, talked a little bit about this issue, but the change order that we're approving today is not for this retention system. That's correct, isn't it? That all we're being asked to approve today is the piping that goes around the.
That's correct. Okay.
Okay. So, I mean, so the bad news here today is the very large ticket item that we're approving doesn't even include this. So we will be back to talk about this at another time.
Maybe to move, are there any other questions on that treatment component? The other component is the 24-inch pipe. At the time of our survey, we did not pick up the fact that, where are we? If I could maybe just point, there's an existing drop inlet in this location, and a 24-inch pipe that runs out to 4th Avenue. And that we picked up because of the nature of the construction of the inlet. It's not a typical inlet where you can look down in and see pipes go in various directions. It just has a small slot in the bottom of the inlet, and the pipe configuration wasn't immediately obvious. So we did not pick up on our survey that there is a 24-inch pipe that extends south as well and it actually continues under buildings and between buildings, and it serves the parking lot on the west side of the admin building. So there is a fair amount of runoff coming through that pipe as well. Now, the problem is we have to route that pipe, that water around this detention system because that system is not designed for the capacity coming from that additional parking lot. So that's the reason why we need to route this 24-inch out east and then south, or, excuse me, north to 4th Street.
Commissioner Bendigo.
Jeff, I'm missing something on this. We have the system currently in place. Have we had any existing problems with the storm drainage issues in the past? Why we would need to change it now, that because it has more roof space than parking lot space?
Well, part of the reason is the existing storm system has to come out for the building expansion. That existing 24-inch running north to 4th Street is, as I understand, right in a row of columns and footings, so it could not remain in place.
But
If that answers your question.
well, kind of. But didn't we know that the footings and the foundations and all that stuff was gonna need to be replaced?
We did, and we had provisions for the storm sewer originally to be routed east and around the building. And that's what was submitted to the city, and that's when the requirement for this underground system came into play. So that was added into the plans, and once we discovered during construction this 24-inch pipe going south, that had to be rerouted around the system because the storm tech system did not have the capacity for the additional flow.
Commissioner Bender, I think, has a comment.
Well, so to clarify for Commissioner Bendigo, it's confusing because we're really talking about two separate issues. And so the second issue is something that was not discovered in this survey, which is a separate issue that we'll probably talk about a little bit more later, but that is now requiring a fairly extensive additional pipe to be added because we have to go all the way around the building, basically. And so that is what this estimated cost of $100,000 to $125,000 is to cover. And the reason we're here today, which is, maybe a little bit earlier than we would normally do in a formal change order, is just because if we don't take action on this today, we are going to interfere with the construction timeline. We're going to push back their ability to continue to move forward, and that's why we felt like we had to bring it forward today.
So the line that we're talking about today, is it that top pink line that's going to the east and then coming back to the north? Is that that's the line that we're talking about today, just that one line from the green space off the map and probably back down to 4th Street?
Correct.
To dump. So that one's gonna cost us around $100,000 to put that in, and that will drain the water off of our administration parking lot.
That's correct.
Okay. Does that clarify where we're at today?
Lots of shaking heads from
Yeah,
the
okay.
construction people, so I'm saying yes.
So we will deal with the other pink lines and the big blob on the side in another day. And then we can have this discussion about whether it's necessary or not. So this one is necessary. This one continues from an existing pipe is replaced.
I'd make a motion to approve the storm drain pipe change order.
I'll second. I think
Second. We
Commissioner
have a
Bendigo might
comment
have
I
a
have
from
just
Commissioner
one other
Bendigo.
dumb question. The plastic piping and collection system that they're recommending, how long is that supposed to last?
It's a very thick, high-density polyethylene pipe, so I would say indefinitely. It's no different really than the sanitary sewer pipes and water main pipes that we put underground.
Okay.
They can be 50 to 100 years.
So
And this-
maybe longer than Commissioner Bendigo?
Longer than you'll have to worry about. Any of us will.
So the pink line that we're putting in is that same product, that really heavy plastic or not?
No, I would assume this would probably be concrete.
Okay.
Yes.
All right, I have a motion and a second to approve this huge change order. All those in favor say aye.
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 Those opposed, same sign. Motion passes unanimously. Thank you. I
you.
guess we will maybe look forward to you coming back to talking about the rest of the pink.
Meeting at 1, so if I get to see some of us earlier than that.
We'll move on to item number 18, which is consider a motion to declare or approve the morning of Christmas Eve, December 24th, as a holiday for Minnehaha County employees. Carol?
Commissioners, Carol Muller, Commission Office. Yes, before you today is information about Christmas Eve. This year, Christmas falls on a Tuesday. We have that holiday off. Our policies, our agreements with the unions all state that the afternoon of Christmas Eve happens to be a holiday. The state of South Dakota has turned this into a 4-day holiday instead of having people just come in for those 4 hours and work. The city of Sioux Falls, as my understanding, has done that also. So before you today is information, is if you want to pursue Christmas Eve as a morning off for employees. Attached to this is the cost that goes into it. The total value of 4 hours worked is approximately $64,000, which includes both salary and benefits, recognizing that we have 24/7 staff that we truly have to pay out. It could be up to $25,000. We also recognize that that actual cost could be lower, as often staff does have the choice if they choose to bank that time instead of getting cash for that. So for your information, you have done this in the past. I will share that. I believe it was 2012 was the last time that you did that. So would bring that forward for your discussion and if you choose to move forward.
Madam Chair,
Commissioner Barrett?
I favor giving Santa a head start. Let's give him that morning off.
Comments?
It is.
Second.
Motion is second. Additional comments?
I would just make the comment, it seems to me that we know that the state and the city is always going to do this. Why don't we just automatically do that, whether we have to go through this all the time, when in fact we've kind of become a branch form of government for the state and all the things that they do anyhow. If they're not available, frankly, we can't do everything we're supposed to do, so we should just automatically plan for that.
I think that that's a discussion for the budget season, so maybe we'll just,
That's
because
fine.
we would talk
Idea.
about that under holidays during budget season, but we will address the 2018 one. I have a motion, a second. Any additional comments? All those in favor say aye.
Aye.
All those opposed, same sign. Merry Christmas. Get an extra half a day. Item number 19 is Minnehaha County Liaison Reports. I would ask, are there any reports? Commissioner
I'm
Barrett?
sorry, I have one item, which is on November 8th at 4:30 p.m., we'll be doing an archive facility ribbon cutting. We won't be meeting next Tuesday, so I just wanted to reiterate this point to be on your agenda.
Okay. Liaison reports, I have two. Just one reminder that we did break up a list of all of our Minnehaha County legislators to meet with before January. I have met with 3 so far. I have the 4th one I'm meeting this week. I don't know how long my list was, talking about different legislative issues that we had discussed as a commission and some with the municipalities, and what types of issues we have in the counties. We talked about the fan report and some of the budget issues that, concerns that we have. And so just to encourage you, I know that initial emails were going out. I know I had trouble getting responses, but now I've been on track and meeting with some people. And so if you didn't get if you didn't get responses from your initial emails with legislators, if you would remember to reach out again before January. Then my next one, I'll make it brief that we had another meeting yesterday, an ITV meeting for about an hour and 45 minutes with the state on the Mental Illness and Correction System Oversight Council. And we had a good turnout, and mostly it was just kind of a briefing of everything that's been going on. There are a lot of movements. There's been some really positive comments about changes that have been made because of the, I'm not going to remember the bill number, House bill that was on mental illness and criminal justice that passed about a year and a half ago. Rapid City reported on the Restoration Center and all the different types of things that they are doing, and they have what they call a campus of care when they've had positive things coming out of that. We talked about expanding the mobile crisis teams. Obviously, Minnehaha County has one, and it's difficult for smaller areas to have them, so they're looking at ways that other areas can have some type of a mobile crisis team. There was a study group this year that was looking at access to mental health services. They gave us a short report on how that was going. Talked about some possible South Dakota codified laws that may have to be changed, and so we're looking at a draft on that. Department of Education had given a grant to the school districts to help identify kids in the school districts with mental illnesses and how they could move forward in neighborhoods and screening of kids in schools that are having issues. We do a mental health screening in the jail when someone is booked in. That has also now been moved to the court services, who are also doing mental health screening, and they have done quite a number of screening already on the people that they are supervising in court services. So it was a very good meeting. I'm sure we'll be hearing more about that in the future. Any other liaison reports? Okay, is there any new business? And under old business, we were going to give direction to the commission staff office as how we wanted to deal with ambulances. So comments, discussion, Commissioner?
I mean, I would just reiterate my comments earlier that I think it would be helpful to go ahead and, in the near future, put together a group that can dig into funding for ambulances and finances so that we can come back in our next budget season, before our next budget season, and have kind of a vetted, thought-through plan about what's appropriate for funding and try to pull in partners with the townships and the cities.
Comments, questions, Commissioner Barth?
I really appreciate your comments, Commissioner, and I think that really leads us in the right direction as we look at things going forward. I know that I had suggested it be an agenda item today, and I know that it's been suggested that MedStar stay here for this point at old business. So with respect to the fact that I absolutely support what you've said, Commissioner Bender, I wonder if we should allow Jay to say a few words. He did sit through what may be our longest meeting this year.
If you have questions for him, that's just fine. You want to address Jay?
Are you okay with things, Jay? He's nodding his head.
You have to ask him a question so he can
Okay.
come forward and answer your
All right.
question.
Jay, are you happy with the direction that Commissioner Bender suggested that we go, which is to, pardon me if I don't say it right here, Commissioner, but to review the whole operation of funding and see what resources are necessary for each district?
Jay Major, MedStar Ambulance, Brandon, South Dakota. It's a start, but as I explained to the commission earlier, and as you listen to all the testimony before you, including with Garrettson, I don't know if Garrettson is still here, but as you heard, we got there as quicker than they did to their own territory. And I want them to stay in business. Don't get me wrong, I'm not here asking to take that territory. But for us to do that costs money. And I'm not quite sure, I don't think the commission understands, because I'm a private enterprise, that all of a sudden I'm independently wealthy and I can afford to do taxpayers' business. Now, as I said in the paper, now, Cindy, out of all due respect, you said that I could have come and spoke during your budget hearings and so forth. I didn't know anything about it. I didn't know I had to. I know I just submitted it, and that's all I knew. So I didn't know I had to come and speak with you at a budget hearing somehow, someplace. I'd have been here if I was invited. And my wife looked on, my wife did look on all of your things on that she could find, and there was nothing on there that you talked about it. So I'm not quite sure where I would talk at the budget hearing about the funds that we requested. But let me throw it out there one more time. And now we're talking next year again. My expenses are 40 times greater than the volunteers, because I do staff 24/7. I have 7 ambulances, and that's for the purpose of county taxpayers' business, not mine. 68% of the people we transport, out of that 68%, we get paid for some of them. Now, the 30% we don't transport, I send an ambulance out, I bring another crew in to cover again for another call that may come in. So I'm paying these guys, and there's no income at all there. Zero. But yet, I promise you, if anybody here crashed at the 406 and you had a life-threatening emergency and we weren't there in 4 minutes, I'd be standing up here talking a different subject right now. Because I did hear some of the commission here question about response times. Well, every second that we add to a response time for an ambulance service, not just mine, but Paramedics Plus, Garrettson, and everybody else, every second that we add to a response time costs money. That's not just saying, hey, the volunteers need to be quicker. No. Our money comes in staffing at the station, ready for a call that may or may not happen that day. Hugely expensive. Now, I did understand that possibly some of the commissioners will say, well, they want to see your financial statement. I'll show you my 911 financial statement. But I'm not going to show you my transit financial statement and my private financial statement and my race rescue financial statement, in which all of those go to pay for my 911 service. I subsidize it myself, me and my family, and I blame this on me. I'm a horrible businessman. I wanted to do this business so bad that I did everything I could to do this business, and I've done it for how many years? And again, I kind of let you guys down because everything I told you I'd do, I've tripled. I did better. I haven't done worse than anything I've told you I was going to do. And all I asked is for a little bit of help taking the edge off my company and my family. Just to take the edge off, not to take the whole $450,000 deficit that it cost me to provide one ambulance in the county, just to take the edge off. And I wasn't invited here to talk to you about the edge. But it was in my information. So I will sit down because, you know, to me, I'm not up here begging. I'm not asking you for a charity because I'm the one giving the charity. I'm asking you for a standby fee, just as you pay for your garbage services and every other service you pay for with a private company. You do fund private companies in payments. I'm asking for a payment of a standby fee to help me take the edge off a 3 to 4 minute response. That's it. I'm going to sit down. Thank you.
Thank you, Jay. Are there any questions? Commissioner Bender?
I don't have any questions. I would like to make a comment that I think we're going to look at this. I think there were lots and lots of questions. This is a new issue for us. I pulled out the application that we got from MedStar. It provided nothing as far as any kind of finances. And so there are a lot of questions we'll need to ask, and that's why we need to put a group together to look at this. So I think that's the way we should go.
Additional comments? Okay, Carol, do you need any more direction of what to go? And obviously, as the sheriff said, February is when the municipalities have to have their budgets in, so we're gonna wanna try to move quickly and get some stuff moving on that. Is there any other old business? Commissioner Barth did mention that there is no commission meeting next week. It is time to go vote. So remember to do your civil service and vote, please. I'd look for a motion to recess the Minnehaha County Commission.
So moved.
Motion and a second.
Second.
I have a second. All those in favor say aye.
Aye.
Those opposed, same sign. Motion passes unanimously. We are recessed at 11:17.